depression is highly treatable among middle-aged and older adults. So let's talk now about the power of treatment. First, we have to get a myth out of the way. The myth is that at a certain age, we're stuck in our ways and we are resistant to change. And that actually is not true. When it comes to therapy, older adults benefit from therapy the same levels as other age groups when treating depression. And so the take-home point is that depression in older adulthood is treatable, and the impact of treatment is significant. Let me give you an example. There was a study that looked at people with depression and mild cognitive impairment. And when people have a diagnosis of mild cognitive impairment, about 10% of those folks convert to a dementia disorder each year. So the risk is higher for this group of developing dementia. So again, they have mild cognitive impairment and depression. But when that depression was treated with an SSRI like citalopram, that treatment, when they engaged in treatment for 4 years with citalopram, taking it regularly, this group that had the highest, most vulnerable risk for developing dementia delayed the onset of dementia by 3 years. And studies looking at midlife treatment of depression also delayed or prevented the onset of dementia later on. And so the good news here is that there is a lot you can do as a therapist to not only impact the person's life today, but also prevent illness and disease down the road, like dementia disorders. And so if you're sitting with a client with low mood or sleep problems or social withdrawal, your interventions and your psychotherapy with that person may be helping more than you know. You're not only easing emotional pain, you're helping to protect memory and independence down the road. I'm Dr. Regina Koepp, and this is your weekly mental health and aging tip.